And welcome to another episode here at Just Podiatry. We have the good fortune of having a young gentleman that unfortunately came in because of a gnarly ingrown toenail. He's from Ireland. I'm trying here. Anyways, young gentleman has presented to our office today with a pyogenic granuloma in conjunction with a small abscess, and last but not least, a paronychia. Take a look. This is gnarly, right? So, the paronychia is the ingrown toenail. We have redness. We have the pyogenic granuloma, also known as proud flesh. It's a benign vascular tumor that we're going to go ahead and also remove shortly. There is, as everyone can see, watch this, there is pus. I hate to use that word. It's purulence, right? Purulence, not pus. But purulence, redness, swelling, and last but not least, pain. So we clearly recommended that we take care of this problem today. The patient has already been anesthetized, this patient from Ireland, and we're going to go ahead and move forward with the procedures as previously discussed and mentioned. First thing we do, we take our little spatula paca. Did that sound good? Paca from Ireland? Okay. Get close back. You know how people are these days. They want to see everything nice and clear. So I'm going to be a little bit overzealous, just like that. You okay up there, bud?
Yep.
Super. This is going to be, the other day, I had a comment from one of my viewers, quite interesting. And the comment this gentleman asked me that we're sort of taking the easy way out, right? By removing more nail than probably I should be. And what do I say to that? It is extremely important to be aggressive when it comes to these paronychias, especially one such as this one. The goal is to eradicate, number one, infection and eradicate pain. If you take very little, especially when you have a granuloma, the likelihood of recurrence is extremely high. So that just popped into my head. So again, it's not that it's the easy way out, take more and that'll take care of the problem. No, it's not like that. The patient, we're not performing a penile procedure. We are performing a simple partial nail avulsion with an incision and drainage, you guys saw the pus already, of the abscess, which is there as a result of the nail, in this case, the offending nail plate into the nail fold. Let's continue. Come close again. Okay. So what we basically do, we go underneath all the way back here. Check this out. Watch this, people. Watch this. Watch this. Look at this. Look at this. Gnarly. This is, so we just go like this, just like that. I'm going to put it right here just so everyone can see. Actually, you know what I'll do? Look at the size of this nail. All of this was in there. So now we're going to go ahead and take again our English anvil, right? And I'm going to come close. We're going to snip, just like that, the pyogenic granuloma. Pyogenic granulomas are extremely, as I mentioned before, extremely vascular. They will bleed and bleed and bleed and bleed and continue to bleed if not cauterized or appropriately, or sometimes they actually stop bleeding. Okay? So the next thing that we're going to do is, like I've always told everyone, we need to make sure that we don't leave any pieces of nail behind. Clean as a whistle. Okay? Just looking at this and doing these procedures, I just feel better for the patient. I mean, how wonderful is that? For all the viewers, if you've never had an ingrown toenail or a paronychia, similar to the video that we posted on gout yesterday, that it's extremely painful, this is also extremely painful. Okay, especially when patients try to do the whole bathroom surgery thing, try to remove it on their own, and they fail to do so. They kind of make it worse maybe, or they go to a pedicure and this is what happens. Not to say that this is what happened, but again, he's gonna do great. So what we'll do now is we'll go ahead and put a nice bandage. The patient is in extremely well. We'll have the patient come back here in about 10 days. We'll reevaluate his condition. We've already discussed the post-procedural instructions and protocol. And like always, I will post this on all of our platforms. If anyone has any questions, please feel free to reach out to us. Like always, live, or actually no, not live, www.jawspodiatry.com, our Facebook, Jaws Podiatry, Instagram, Dr. Toe Jam, and last but not least, our YouTube channel, Jaws Healthcare. Signing off from a gnarly paronychia here at Jaws Podiatry.
It's gnarly.
Excuse me, gnarly. Like always, thank you for watching, guys.